Welcome back. Did you know that 1 in every 10 claims is denied in the healthcare industry? That's right, denials are becoming more and more common, and unfortunately there's no way to completely eliminate denial codes. This can be frustrating, but don't worry, there are ways to reduce these denials and get your claims approved faster. Today we're diving into what denial codes are, and specifically denial code CO15, and how you can avoid it. So let's get started. First, let's quickly talk about what denial codes actually are. When a claim is submitted with an error, your billing department will receive a denial code. These codes help identify exactly what went wrong in the claim. Now, why do billing departments hate receiving these codes? Well, each denial code can have multiple reasons behind it, making it a bit overwhelming to figure out what caused the issue. There are two main types of denial codes you'll come across: CO codes and PR codes. A CO code means contractually obligated, which means the insurance company is supposed to pay for the entire service, but something went wrong with the claim. On the other hand, PR codes stand for patient responsibility, meaning the patient is responsible for the entirety of the bill, not the insurance provider. Now, let's dive into what denial code CO15 actually is. The particular code will pop up when there's an issue with the authorization number for a procedure. Maybe the authorization number is missing, expired, or was entered in incorrectly. The CO15 code happens because the insurance provider is contractually obligated to pay for the bill, but an issue with authorization stops them from doing so. But don't worry, this is a problem that's fairly easy to fix if you know what you're looking for. So what causes this CO15 denial code? Let's go over the most common reasons. Missing authorization. Sometimes before a procedure can be done, the patient needs to get prior authorization from the insurance provider. If this step is missed, the billing department will get the CO15 denial code. Invalid authorization numbers. Even if the authorization was obtained, the number might have been entered incorrectly. Whether by a simple typo or using an outdated number, this is another reason for the CO15 denial code. Missing or incorrect documentation. The medical records submitted with the claim need to be complete and accurate. If any information is missing or incorrect, the claim may get denied. Now that we've talked about this denial, let's talk about the impact it has on your organization. Delayed payments. When a claim gets denied, it delays the payment process. Your billing department will have to figure out what went wrong and if they need to appeal the denial. That will take even more time. Claim resubmission. Once a denial is identified, the claim has to be resubmitted. This takes time and resources away from your billing team, delaying the process even further. Stress on patients and staff. Denials can be frustrating for both your patients and billing team. Patients might start calling frequently, and the billing department might get stressed, leading to even more frustration. So, how can you prevent denial code CO15? Let's go over some tips to help reduce the occurrence. Utilizing technology. One of the easiest ways to avoid CO15 denials is by using electronic health records, or EHR systems. These systems can help reduce errors and improve accuracy throughout the billing process. Establish clear authorization procedures. Make sure your team has a clear process for obtaining prior authorization before procedures. This ensures the correct authorization number is in place. Train your staff properly. Proper training is key. Make sure your staff is familiar with the correct coding and documentation procedures to reduce the risk of errors. Even with all these precautions, you may still receive a CO15 denial. So here's what you should do next. Review the claim. First, go over the claim carefully to check for any errors. A simple typo could be the cause of the denial. Verify the authorization. Double check these authorization numbers, ensure that the one provided is correct and not expired. Submit the corrected claim. If you find an error, correct it and resubmit the claim as soon as possible. Keep in mind that insurance companies have a limited time to accept corrected claims. Appeal if necessary. If no errors are found, you may need to appeal the denial. Make sure you have all the necessary documentation to support your case. Denial code CO15 can be frustrating, but with the right knowledge and tools, it's manageable. By understanding the causes of the code, implementing best practices like using technology, training your staff, and having clear authorization procedures, you can reduce the likelihood of denials. And remember, even if you do receive a CO15 denial, it's not the end of the road. Review, verify, resubmit, and appeal if necessary to keep your claims moving smoothly. If you want to learn more about the revenue cycle management process, reach out to Tactics. And since you've made it this far into the video, you might as well like it, share it, and comment down below.